Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. A little news before we go to Dr. Fine. A staffer at the Joint Committee at Legislative Services has been arrested and charged with drug charges and effort to deliver those drugs, drug dealing. He has been fired by the Speaker's office, according to Larry Berman, and that story is developing. GoLocal just broke that. You can see it on the site. Later on this afternoon, we're going to have at 2 o'clock Mike DeBiase, former Director of Administration under the Raimondo administration, and now the head of Rhode Island Public Expenditure Council. We're going to go over where his organization thinks the Rhode Island economy is right now and where it needs to go. Now, let's go to Dr. Michael Fine, who's in Pawtucket right now. Dr. Fine, thanks so much for joining us.
Hi, Josh. I'm in Pawtucket, and except for when I'm talking to you, I'm wearing a mask all the time.
Thanks, Dr. Fine. And he, just so you know, pre-broadcast offered to wear the mask during the broadcast as a true clinician. Dr. Fine, let's go through the numbers. A bump up in national deaths and the number of American deaths in the last 24 hours. Take us through what the data shows.
Around the world, first, over 1 million people have recovered. 3.25 million, 3.25 million tested positives in the United States, 1,066,000 positives, an increase. Our positives are continuing to increase in the United States at 25, 26, 27,000 a day, which means we just aren't done yet as a nation. That's going to turn into 2,500 deaths in a month or in a couple of weeks. So I think the United States deaths are now at 61, almost 62,000, going up 2,500 to 2,300, something like that every day. And that's going to keep happening based on the tested positive numbers, or so we would expect. That means we're now, as I said, about 62,000 deaths, unfortunately. We are very likely to pass 70,000 deaths by the end of May, if not by the middle of the May, heartbreakingly.
Yeah.
World deaths continue apace, 10,000 in the last 24 hours. And I'm really, really worried about what we're going to see in Africa and in South America, in Asia, and the really congested places as this virus takes its toll. But again, over 1 million people have recovered, and that's where our hope is. In Rhode Island yesterday, we talked about the numbers yesterday. I couldn't get the new numbers from today yet. We'll wait and see, remembering that the number of positives is going to be related to the number of tests.
Right. Let's talk about the governor's decision yesterday. It's been tagged as canceling summer. No events larger than 50 people, including weddings, which I thought was quite a remarkable statement. But no 4th of July parade, no jazz festival, folk festival, you name it. All the major events that bring us together, annual events that are so important to the fabric of the community. Did we miss an opportunity? Are we trapped now in a cycle of just cancellation and not try and innovate how we can recreate events during this period of time?
Well, I don't want to second guess the governor or her policy, but maybe we're in a place where it's easier to say blanket no now and then find ways to innovate and experiment as we get closer to summer. Let someone propose. The governor is a champion of innovation. Maybe let somebody propose some innovations that we haven't thought of. Things like, if antibody testing becomes more sophisticated and we find it's reliable, let everyone who's antibody positive go to something and see what happens. There are probably 100 different ways of skinning the cat. Maybe we need an antibody positive beach, just so people can actually, we're going to have to spend some time. I think the Swedish model continues to be instructive, which is kind of ask older people to stay home, get them all the stuff they need to have some fun at it, let's pipe in music and pipe in theater. I'm going to go see some piped in theater, some Zoom theater tomorrow night. Let's do all that stuff for old fogies like me, and let younger people spend some time together because they have very little risk. Um, you know, I think this is the moment where the spirit of innovation can bloom.
Dr. Fine, you make a good point, and the numbers are certainly an interesting milestone of what's happening in Sweden, and I think something that now a lot of the world is looking at. You talked about Africa, portions of Asia, and South America, where in many of those countries, the idea of washing your hands and singing happy birthday twice is as foreign as jumping on a space shuttle and going to Mars, because that's just not an opportunity for anyone in those countries due to the poverty of those countries. Talk a little bit about what those countries can do. You know some of those developing countries well.
I've spent a little time in Liberia, and Liberia is in some ways a good example. The outbreak of Ebola in 2014 in Liberia happened in the summer. By September, CDC was expecting that by the coming January, there were going to be 1.4 million deaths in Liberia. And then the process of community organizing took over. Actually, Partners in Health was brilliant in this way. They used community health workers and worked with local communities who really didn't trust the government, and got people themselves thinking about how to protect their own communities. They did hand washing. They worked with disinfectants. They understood what kind of distance they needed from people. So instead of having 1.4 million deaths, they ended up tragically with 10,000 deaths. But 10,000 is way better than 1.4 million. And it was communities themselves that ended the spread. And one hopes this is an opportunity for people who understand community health and world health to think differently about different places and come up with solutions coming from communities themselves that make sense in those places instead of being imposed by the outside. I mean, we have no drug and no vaccine to offer. So what we can offer is the strength and the resiliency that comes from communities organizing themselves to protect themselves, because essentially there's no one else who can.
Dr. Fine, yesterday we had on Dr. Owens from University Orthopedics, part of Warren Alpert Medical School as well, and he's a top ortho surgeon. Their new facility over in East Providence is able to do most of the surgeries that they years ago would have done at Rhode Island Hospital. Do we need to rethink sort of separating different specialties from the traditional emergency room, bigger hospital experience for the next year, and allow people to get those treatments, move cancer treatments out of Rhode Island Hospital, or isolate it completely so people can go and get the health care they need, so we're not, the number of coronaviruses are here. We may double the number of related deaths because people can't get the treatment or are afraid to go into an environment in which they might be exposed.
Well, some of us have been thinking that for a long time. There's some evidence. We did some study when I was in state government that makes it look like Rhode Island had 50% more hospital beds than it needed. And the way to change, it sort of reflected changes in the technology. Because most of what used to happen in the hospital doesn't need to happen at all. Part of the reason that hospitals exist is to kind of run the billing process so they can continue to have enough volume to stay in business. We need to, again, this is long past time to rethink this whole thing, to shrink the number of hospitals, to be able to have lots more expandable ICUs. I sometimes think that whenever we build a new hotel, we should build it with ICU capacity, the ability to flip over and use it as an ICU if we have to go through something like this again. And then do as little in the hospital as we can, doing most things outside of the hospital in the community in different ways.
As you see things playing out, we've seen a couple trends. One, very stable number of those who are hospitalized, a pretty stable number of those in the ICU in Rhode Island. But we're now fourth highest in number of cases per 1 million, and we're eighth highest in number of deaths per 1 million. How have we been able to balance those two things? And are those a strong indicator that we may start to want to rethink what our policies are, because we need to be able to reinstill the economy as we talked about at the beginning?
Well, I think thinking carefully and parsing what we've got is going to be challenging. We are sometimes intimidated by the number of cases. I did an analysis earlier in the week that looked at the percent of positive cases who ended up in the hospital. In New York, it's 33%. In Rhode Island, it's 12%. And what that suggests is that by testing a lot, we're finding a lot of asymptomatic or minimally symptomatic people. There's no harm in that by any means. It helps us do contact tracing and disease control. But it doesn't mean that we have to be scared by the number of cases we have, or even have to jump through hoops because we have a certain number of cases. I continue to say focus on hospitalizations and focus on deaths. Vis-a-vis deaths, what we're experiencing are basically nursing home deaths. 80% of our deaths are nursing home. The flip side is actually quite miraculous. We only have about 50 non-nursing home deaths. We are not, thank God, seeing the deaths of young people. So we're doing really well, and I think a part of it is the unintended consequence of social distancing, a good consequence by any means. But as we think about our numbers of deaths, I think we have to be realistic about what to expect because of the number of people we have in nursing homes and because of the number of people in Rhode Island who are over 85. We have one of the highest percentages in the nation. And so, unfortunately, with this virus as it is, we're going to have a lot of deaths. Most of those people are going to be older. And our job, in my view, is to turn our attention to a statistic called years of preventable life lost. That what we want to do is really devote energy to saving the people who have long lives ahead of us, because those lives are precious. Not that any life isn't precious, all lives are precious, but to lose the lives of young people is particularly painful. And what we see is the lives of young people we lose tend to skew toward people who are people of color, and that's where we need to make sure that we do better yet.
GoLocal continues to get reports that been very difficult in Pawtucket and Central Falls to get Latino community to come out and be tested. That is still a struggle. Received photographs from one of the testing facilities in Pawtucket. Was almost empty. The count of folks who are going through was low. Is that just an absolute fear for those who shun the healthcare system and those that are undocumented that are just so fearful of government interaction during this period of time?
I suspect there are multiple roadblocks. I'm in Pawtucket working on that issue today, as I do every day, and have done every day fairly intensely for the last month. There are multiple roadblocks. There are people who are undocumented. There are people who are uninsured. I did an interview on a Latino television radio station over the weekend, and interestingly, the first question I was asked was not anything about the virus particularly, but it was framed as, people are hearing lots of conspiracy theories about the virus. This goes back among people of color, I suspect, to the legacy of Tuskegee, where people of color have been used almost as experimentally and are very suspicious sometimes of the healthcare system, and that's with good reason. They get used as a source of income, but no one's particularly interested in showing up and making sure that things work for everyone. And so we've got lots of things to get past. We have to provide really good communication to every single household, which is what we're working on in Central Falls and Pawtucket. Trusted messaging. We need to make sure that clear messaging about isolation and giving people support in isolation. We have to make testing way easier than we've made it before, way more accessible. You know, the National Guard sites, when they got set up, they didn't get set up originally in Pawtucket and Central Falls. They got set up at URI, at CCRI, and at RIC, not exactly where the at-risk population center is, and that sent a real message to everyone. Yeah. So we've got a lot of catch-up work to do to turn that around.
Sunday is going to be 70 degrees, sunny. It's going to feel like it's 90 degrees after the last week of gloom and doom for most of this past week. Is there a developing strategy of some mild sense of enforcement on social distancing? California has been such a disaster in allowing beaches and parks open that Governor Gavin Newsom is expected to close all beaches and parks accordingly.
I think there is not a clear sense inside state government about enforcement policy. I actually think my colleagues, are trying to be both advance the notion of social distancing, but are being cautious about enforcement for lots of reasons, some of which have to do with the suspicion, particularly of minority communities, of law enforcement itself. I'm not sure that's a workable divide. I actually think we need a whole society approach, and that enforcement is part of it. We've tried to be thoughtful in Central Falls in particular, but also pretty consistent. And I think the state would do better if we were, not crazy about enforcement, but pretty clear and consistent, and involved our law enforcement colleagues as colleagues, and didn't try to make them into the problem, because they're really committed people who are pretty dedicated to their communities and to a solution. So I think we need to do this together, and they have a role, and it's not to sort of arrest people and put them in jail. It's to remind people and to be there for people, but to be a consistent presence and a clear voice, so that we don't say one thing on Smith Hill and then let a different thing happen in beaches and parks.
Dr. Michael Fine, the last word for you.
Like you said, it's going to be nice. It's important for people to continue to be careful, and for us to look at a different life and to be innovative about that different life, and to stay in touch with each other so people feel connected and can get through the next month, which is going to be the toughest month of all, I suspect.
Thank you so much, Dr. Michael Fine. Thank you so much for joining us, as always. For everybody else, 2 p.m., join us. That'll be Mike DeBiase, the CEO of Rhode Island Public Expenditure Council, going over where the state's budget is right now. Thanks so much for joining us.
Thanks, Josh.